Hello, everybody on Facebook. Hello, everybody on YouTube. Thank you so much. Thank you so much. So, first of all, I'd like you all to know that this month is Colon Awareness Month. And I'm having the awesome Dr. Haung with us today on the show. And we're going to discuss that today. So, once again, I really appreciate everyone being here. Excuse me when I get a little comfortable. Dr. Haung, welcome today. How are you?
I'm just fine. Thank you for having me.
No, thank you for taking time. And I know you have some patience, but I know personally that this really is an important conversation that we should have also. So, I just want to get you on this. And my apologies, everybody. You know how I roll. I get all about moving around and stuff. So, first of all, I once again thank you so much for speaking today with me and understanding. So, some of the things that I had sent you was I kind of just wanted to know. First of all, can you tell us a little about your background? I know before we had discussed this and stuff, and I think we were discussing about Botox and Juvederms and things like that, and then we had an HRT program also that you were on. But I don't think people really understand what really a primary care physician actually what their title actually stands for. So, can you, before we move on to that, could you just explain what your job is actually, or I should say your practice is, please?
Well, how much time do you have?
Oh, we got plenty of time.
So as a primary care physician and specifically a family doctor, I see all ages from the womb to the tomb, from the cradle to the grave. So all ages, infants to over 100 years old, men, women. We do gynecology. And our main focus, however, is preventative medicine. So we really want to talk about prevention. We really emphasize the importance of coming in for our annual physical. And the point of that is to make sure that we are making sure you're up to date with all your screening tests. For example, for women, mammograms, pap smears, and then what we're going to talk about today, colon cancer screening. Very important because our goal is to keep these things from happening in the first place. So that's what that's our goal is prevention.
Okay, all right. And I appreciate you giving us a little background. The only reason why I had brought that up is some individuals at times just say, oh, I have to see another doctor because a primary care physician really doesn't know what I have. But the beginning steps is in order to see a specialist, they need to see their primary care physician, correct?
Yeah, so we're also known as quote unquote the gatekeeper. We can help people by guiding them in the right direction to help them decide what type of specialist they need. And also, in your appointment with me, I would help determine and narrow down what exactly your condition is so that I can help the specialist help you to the best degree that they can.
Okay, thank you. Thank you for elaborating that. I really appreciate that. So now we're gonna go right in for the dig. You ready? So I get confused because of course I have guy friends, girls that are my friends also, and I don't think they're understanding that even a female and a male they both can get it. So one of my question is, I want to know what is exactly colon cancer and how does it develop?
So colon cancer is cancer that happens in the colon, and cancer happens anytime there are mutations or changes in cells from being normal to what we call like malignant or cancer. So it can start off as just a small polyp, which a polyp is a generic term for just a cluster of cells. So not all cells, not all polyps are cancerous, but it just starts off as cells that start to mutate and become cancer.
Okay. Now, like, and I understand that, but do you know what the statistics would be on that? Because I know I've done some little research on the statistics and I wanted to know, obviously you probably know not probably, you do know a lot more than me. So what would be the statistics on that?
Of colon cancer, well, I believe, don't quote me, but I think that colon cancer is probably the third most common cancer in the United States for men and women.
Absolutely.
But okay,
You're right.
Okay. Oh, and I don't know if you noticed, I'm wearing blue because blue is the ribbon for Colon Cancer Awareness Month.
Awesome. I see it. Very nice. Very nice. You know what, though? Let me get you bigger on the screen. And I do apologize. Once
Oh,
again,
you don't have to do that. That's not necessary.
well, I'm already up and I'm already here. So let me make it bigger. There we go. There we go. Let me see if it can get on the screen so people can see your beautiful face, Dr. Haung, and your beautiful blue. So from what I researched on it, if you don't mind, I'd like to, in 2023, I can tell you what the statistics were, if you don't mind me just stating it.
Oh, please share.
So the rate of colon cancer, you're absolutely right, was the third most common cancer diagnosed in both men and women in the US. So lifetime risk approximately was 1 in 24, about 4.1% for the men, and 1 in 25, about 4% for women will develop colon cancer in their lifetime. And the specific statistics showed in 2003, an estimated 106,970. Ooh, I had to breathe for that one. New cases of colon cancers are projected for men. The lifetime risk of developing colon cancer for men is about 4.2. In 2023, an estimated 99,780 new cases of colon cancers are projected for women. The lifetime risk of developing colon cancer for women is about 4%. So, what, like, the mortality rate of colon cancer is also the leading cause of cancer related to deaths in 2023. It's estimated that 52,550 deaths from colon cancers will occur, affecting both genders. That's both of them compiled as one. So,
Wow, that's really quite a shame because it is really, if people would do their screening, that would be highly preventable. That's kind of sad to hear.
okay, so let me ask you, since we came up with the statistics and we both researched them, obviously you knew and I researched it. So are there specific factors that affect men and women differently when it comes to colon cancer?
So it's not a matter of men versus women. I would say that age is number one. So naturally, as we age, there's a higher likelihood that cells can start to mutate. Um, some other risk factors are if you have a history of inflammatory bowel disease, which includes ulcerative colitis and Crohn's disease, which is different from irritable bowel syndrome. We're talking about inflammatory bowel disease. That'll put you at increased risk. Obviously, if you have a personal history of cancer or family history of colon cancer, interestingly enough, African Americans are at higher risk. And there are also some genetic conditions. There's something called Lynch syndrome, where you can be at higher risk for colon cancer, and also a condition called FAP or familial adenosis polyposis, where you produce lots and lots of polyps.
Try saying
So
that 5 times fast.
You can just say FAP and sound cool.
I'll go with that one.
So you can literally have like hundreds of polyps. So when you have that many polyps, there's going to be a higher likelihood that one of them is going to be cancerous. So those are the risk factors. It's not a difference of sex. It's more age and these other genetic conditions, and also if you're African American.
Okay, thank you. So what are some of the signs and symptoms of colon cancer that people should be aware of? What should me, as a 54-year-old man, should I be aware of it? And you had said specifically there's an age that it affects more of. What's the number? Would you be able to tell me what a number where I should start looking in to getting looked at?
Sure. So the scary thing is sometimes there are no signs at all, which is why we
Sorry.
really emphasize the importance of screening. And to answer your question about what age, so we used to start screening at age at age 50, but we recently decreased that age to 45 because we are finding colon cancer in folks a lot younger. I mean, I've had some of my patients myself in their 20s and 30s get diagnosed with colon cancer. So screening is really important. And I predict that maybe they might even decrease the age of screening from 45 to even younger. So right now, though, it is 45 to start screening unless you have a family history. So if, for example, you have a relative that had colon cancer at 40, we would start 10 years earlier. So you would start at age 30.
Okay.
But going back to signs and symptoms, like I said, sometimes there can be no signs or symptoms. So again, do your screening. The other things we look for are unexplained weight loss. So you're losing weight, you don't know why, you haven't changed anything with your exercise or diet routine, and unexplained weight loss, automatically we make sure your colonoscopy is up to date. Some other more obvious symptoms are stomach pain, blood in the stool, feeling like when you poop, you're not emptying all the way, like you still feel like there's some stool left. Some other things are change in bowel habits, either constipation or diarrhea. You could go either way. Or also if you have skinny stools, because then that means that there could be something blocking it. So
Skinny stools. What is skinny stools? I've never heard of that term. So what is it? There's big stools and little stools, and I've never heard of this.
Well, yeah, we say like pencil thin. Like when you used to play with Play-Doh, like and then like you squish it through. So obviously, if there's a blockage, it's gonna come out skinnier.
Oh.
I know you. Yeah, I mean, it might be weird to look at your poop, but maybe you should.
Okay. So one of my questions, because I find that interesting when you were talking, when obviously I asked you about symptoms, but my other comment is, I know when I went a long time ago, they do, and correct me if I'm wrong, digitize or whatever it is. Like what type?
Rectal exam?
Yeah, what type of exam do they do now? Like, because I remember me and you were discussing this privately, and you said that doesn't work because your fingers aren't long enough. And, I thought you meant it as a joke, but obviously it wasn't a joke. So me personally, I'd like to know what that actually meant.
Well, back in the day, decades ago, we used to do exams for what we call like occult blood, which is like blood in your poop that you can't actually see with a naked eye. So we used to do what we called a chemical test. We would do a rectal exam and then smear your poop on this card and then put this on there's blood. But that's not very sensitive or specific. So I mean, just the trauma of the finger going can cause blood. So we don't do that anymore.
Okay. I want to make sure I know this.
I'm glad that we don't do that anymore. I'm sure patients are glad. So we don't do that. So the gold standard now is a colonoscopy, which it's a camera that we insert up the rectum and it goes up into the colon. And then the great thing about the colonoscopy is they can see it on the video, on TV, and if they see a polyp during the colonoscopy, they can just remove it right then and there, and you don't have to worry about it. If you really don't want to do a colonoscopy, we have the option of doing what we call a Cologuard test. Do you know what that is?
I've seen a couple of those boxes in your office.
Yeah, so the Cologuard test is it's a box that gets sent to your house and you can do in the comfort of your own home. So we're testing your poop. So
you're not actually testing it, right? You're sending it somewhere to be tested, right?
Yeah, but you have to prepare it. You have to provide the poop. So if you go to my Instagram, you can see a video Woody Harrelson talking to the boxes.
What's your Instagram?
At radiant.medispa.
At radiant.medispa. Gotcha. Follow
So how
at radiant.medispa to get more informative information.
So how the Cologuard works is it picks up DNA from cancerous DNA from polyps. So, but the polyp has to be big enough to shed the cancerous cells into your poop. So you basically put this tub under your toilet seat, you poop into it, and then the kit has instructions. You take this brush and you it's like a little like Friday night, craft thing. So you take this brush.
I don't know
you,
what Friday night craft thing you're doing, but that does not sound like any fun to me. But go ahead.
you gently brush your poop and put it in a tube.
Brush it with like
and then
a brush or a comb.
It comes in the kit. It comes in the kit.
Oh my God.
Yeah.
Oh my God.
And then you pour this liquid into the tub where your poop is to preserve it. And then you call UPS and they can either pick it up or you can drop it off yourself. Now, so that is an option for people who don't want to do a colonoscopy. I have some funny stories. So if you have too much poop in the tub, it will get rejected. So you want just a normal bowel movement, not too much poop and no liquid poop and no blood in the poop. So if it's that time of the month for women, you can't do it, and don't poop too much.
Oh, so now you have to stop it. I'd just like to go back a couple of seconds ago. You said the greatest thing. The greatest thing to me, if that was to happen, was to be knocked out. Do they knock you out for this? Or are you awake while they're doing all this stuff if I don't get the colon in the box? And on top of it, colon in the box or going in and getting a camera is a better way. So which one would you, as a primary care physician, who obviously has dealt with this for over 20 some odd years, what's your advice? Where would you lead people to go?
I would say do the colonoscopy because it's not only looking for things, it can actually treat things. Because, like I said, while you're in there, if they see the polyp, they just remove it. And if you have a good, clean colonoscopy, you don't have to go back for 10 years. The Cologuard poop in the box test isn't as sensitive because, again, the polyp has to be big enough to pick up any cancer cells. So if that's negative, you have to do it again in 3 years. And that is because it's not as accurate. So, again, That's why it's only every 3 years. So, I mean, I've never done the poop in the box. I prefer the colonoscopy. Oh, and to answer your question, do they knock you out? It depends. I mean, they give you a little version of fentanyl. You get a great rest. I wake up, it's all over with. Some people like to stay awake. They don't want to go under. And that will unfortunately can also depend on.
Yeah, that's not happening. Okay. Knock me out. Knock me out.
So there are options.
So one of my questions, so I know we've been discussing this, how is colon cancer diagnosed though? So they go in there, they pull a polyp out, like, I never understood that.
So they take the polyp out during the colonoscopy, not the poop in the box, in the colonoscopy, and then they send it to the pathology lab and they look at it under the microscope and they analyze it to see what kind of cancer or what kind of cells are in the polyp.
Okay, so what do screenings play in an early detection for that?
So the good thing about screenings is hopefully we're catching polyps before they become cancerous. So, for example, I was just talking to one of my colleagues, Dr. Na. She works at Digestive Health Association in Stoneham, and she was telling me she had 2 patients that she diagnosed with colon cancer last week. They came in for their first colonoscopy ever. And, you're hoping you just go in and get the colonoscopy and it's all going to be great. But unfortunately, or maybe fortunately, she found cancer. But because they went in so early, the polyps were small, they hadn't spread. So, they were able to be taken out and the outcome is good. in that situation. So that's why prevention is key.
Well, God bless my prayers to them. And I'm glad that they had, well, I'm not glad that they had it, but I'm glad that early detection is going to prevent it. So, and help diagnose this and keep it moving forward. One of my questions, and I know we discussed, there was, you said the age to start screening, and I do apologize. I remember you saying it, but I don't think you stated, does it matter for male and female, or is that a specific age that you should start? Doesn't matter if you're a girl or guy, you start it, correct?
Yes, it is 45 for the general population. So, I mean, when I say general population, that means like you don't have a family history or a personal history of cancer. So it's 45. But if you have a family member who had colon cancer, you're going to start 10 years earlier than whenever they were diagnosed. Now, the
Okay.
other thing that might impact when you get your colonoscopy is you could do genetic testing. So genetic testing would look for any gene mutations that you have that would predispose you to colon cancer. So I use a company called Natera, and it's very easy. We can draw blood or do a saliva test, and it looks for gene mutations to see if you're at risk. So meaning that you don't have the cancer yet, but you have, because of your genetic makeup, there's a higher likelihood that you're going to develop it. And so if you have a gene mutation for colon cancer, you might want to do a colonoscopy sooner than the recommendation of 45.
Okay, so I think that's going to roll into one of my other questions. What preventive measures can an individual take to reduce their risk of developing colon cancer? Nutrition's a value, all this you're saying, like obviously large consumption of alcohol and things like that. Like what should the people that are watching know? How should we already start trying to prevent that and live that healthy life so we don't deal with this?
I would say that the most important thing is, like you said, to maintain a healthy lifestyle. So obviously limiting toxins in your body, so limiting nicotine and alcohol. Also, a high fiber, low fat diet is going to be helpful. A healthy lifestyle to maintain an ideal weight is great too, and exercise. So just overall, being in good health is going to prevent or decrease your likelihood of developing cancer.
Okay, so we're talking about diets is definitely preventable, exercise and water consumptions and things like this, correct? Is
Yes.
that's all in one? Okay, awesome. Thank you, Dr. Wong. I appreciate that. Now, are there any
Oh, did you want to?
Oh, go ahead.
Oh, I was going to say, you know what we didn't talk about that maybe some people are wondering is the prep for the colonoscopy. I have a lot of patients who that is like a really big a reason why they're afraid of the
Yes,
colonoscopy. Do you want me to talk about that?
absolutely not to cut you off, but we both have somebody that's very dear and close to us that just had that done. And I have I remember when I did one a very long time ago, I just drank a drink and that's it. This person had all these things. Like she has to diet for 2 years before it happens. Like, please go ahead. And you know what I'm talking about.
So this is so I personally I've had 3 colonoscopies.
So you're a
this is my
pro.
go-to. I'm a pro.
All right.
So I'll tell you what my strategy is. So the week of I like to go on a Friday for my colonoscopy first thing in the morning. So I'm in and out, and then that way I have the rest of my Friday off because if they give you twilight, you can't drive or make any major decisions. Like they say, don't like ask someone to marry you or buy our house because you're under the influence still. So I like to go Friday morning and then have the rest of the weekend off. But so starting Monday, I start eating a little lighter and cleaner because less food, less poop to come out. And then the day before my procedure, I don't eat anything in the afternoon and I start drinking the prep. So back when I did it 20 years ago, it was a whole gallon. And then I did it like 10 years ago, and then it was a half a gallon. And the last time I did it a few years ago, it was just like 2 mason jars of prep, and that was it. some GI docs just give you like Ducalox, which is just pills that you swallow and you poop it out. And that's it.
So you're basically saying as you're prepping, don't go food shopping.
Well, you can shop for after because I get quite hungry because I haven't eaten for half a day, so I'm ready to eat.
So one of my questions, and I don't even remember if I asked you, are there any what are the misconceptions that people think of colon cancer?
Um, I'm not sure what you mean by that question. I think for me as a physician, it's very frustrating when I have
Well,
to
I
tell
should
people
say
probably.
my apologies. I should basically finish my comment. Are there any misconception about colon cancer preventive that you would like to address? So, for
No.
instance, and I'll just want to give you an example. I've had people call me up because I used to own a nutrition store too, and they would call me up and say, "Well, someone told me if I load up on mus and mucilin and all this and constantly flush out my system, it regulates it, so colon will never grow in my I mean, cancer will never grow in my colon." So I know me back in the day, people used to overload on pills thinking that it cleans out cancer.
So I think that goes back to what we were talking about preventive measures and basically like decreasing the amount of fat in your diet, doing more high fiber. So when you eat cleaner, you're going to have more antioxidants. So antioxidants are the key to cancer prevention. So I think it's not the actual like supplements that you're taking, but maybe just limiting fats and things that are harmful to your cells.
All right, great, great. So I know we're almost at the closing because I know you do have patience, but if you give me a moment, I just want to know what advice do you have for individuals who may be hesitant to discuss colon cancer with their healthcare provider? Can you share any success stories or positive outcomes from patients who took proactive measures regarding their colon health? And I know you had spoken about a friend of yours that's in the field, but how about you specific? Because I know personally, you've told me some incredible stories that you found, skin cancer and things like that. So have you had any success stories in that whole?
Um, I'd say that the key point is that do your screening when when it's time for you to do it, and even waiting a year or two can make a big difference. So don't delay. Sometimes I have to talk to people 3 years in a row. They turn 45. I'm at their physical. I'm like, okay, time for a colonoscopy, and they want to think about it. And by the time they're 49, they finally go. And you know, sometimes I don't get great news. We find cancer, and for me, that's really heartbreaking because I feel like if they had just gone a few years earlier when I told them to go, that it would have been found sooner. Which is part of the reason why I think that they may have decreased the age of screening from 50 to 45 because you start talking to someone at 50, they don't realistically go. A lot of my patients don't realistically go for another 3 to 5 years. It takes time for them to really process and accept that they need to go get this easily preventable procedure done. So I just
Okay.
say just do it.
All right, great. I have a great question from Elaine McKinney. So I believe we both know Elaine
Hi, Elaine.
McKinney. Hello, Elaine. Elaine wanted to know, is there a cutoff age for this? When do you no longer go?
That's a great question. So right now, according to the United States Preventive Services Task Force, the stop at 75. But that being said, I believe that if you're a healthy over 75-year-old patient, that you should continue screening. Because I mean, people are living into their 90s and 100. If you're healthy, I would say yeah, keep doing it. Of course, unfortunately, in America, insurance is an issue. So, have to check with the insurance company to see if they'll pay for it. But I'd say if you're a healthy over 75, why not?
Okay, great. Thank you so much. Dr. Wang, I really appreciate your time, and I know you're in the middle of your day with your patients, but also I wanted to ask you on the air is so we know every month there's an awareness from some type of disease. And I was wondering if I was to ask you, would you be welcome? And I'd love to invite you monthly where you could speak on something, and then obviously you could speak on stuff about your practice anytime you would like to be on air. Could I lock you in for that?
Absolutely. That would be my pleasure.
Awesome. Listen
I
up.
thought you were going to ask me to marry you.
Yeah, that already
That would be a
happened.
lot of
That already happened. So one of my last things to everyone, if you did not write a question or had any type of questions that you wanted to, feel free. We I write down notations, I develop questions off it, and then I can ask the good doctor again. And I'm sure she can, if it's like a couple of questions or whatever, I'm sure she can make time for us to jump on again. Dr. Wong, I really appreciate it from the bottom of my heart, especially because it's personal to me with colon cancer and stuff. And I'd love to discuss breast cancer and all these other things that are happening with these growing diseases that are now are I don't get it. It's like happening out of nowhere. But I really, really from the bottom of my heart appreciate your time. Thank you so much.
All right. Thank you for having me.
All right, be blessed. Hey everyone, thank you so much for joining us on Security Tales. Now, what I want to tell you is tomorrow, Friday, I will be having a very close, dear friend of mine, childhood friend of mine, a success story about him and his brother. I'll be having Peter DePisa on. Was unable to get Robert on, but Peter's going to join us. He's flying in from Florida to actually come down. So I would love to have you guys all watching tomorrow, and you can hear some stories of how him and his brother successfully build an empire. An empire. They started from working at a club to parking cars. Peter's got so many great stories. I got mad love for him. He's definitely a family member, and so much respect for him and his brother. Now they own. Prepare yourself. They own the Golden Banana. They own the Squires. They own the Tens in Salisbury. And I'm going to ask the most infamous question because you always hear stories about the bad boys. You always hear stories about this and that. Let's find out what nationality Peter really is. And if anyone wants to inquire on my instant message or on my Facebook, go to Guardian Capital or Boston Tales. It's on there, or just write it on the thing. Maybe we'll do a little wager and we'll see whoever wins. I send them a little card, maybe from D&D or Starbucks or something. All right. Hey everyone, I really appreciate your time today. I really appreciate the thoughts and everything from everybody that's encouraging us to keep going forward on that. I keep saying us, but Chris ain't here today, so it was me and Dr. Wong. But I really, really appreciate it. And like I keep saying, if you guys got any ideas, anything that you want us to discuss or me to discuss, let me know. I know a lot of people want me to discuss prison stories and things like that. And I've already discussed it, but I do have some close friends of mine that just retired. I'm trying to get them in, but now that they retired, they're trying to spend a little time with the family, and that's what it's about right now. So once they get relaxed in, I'd love to get them in, and we'll all just tell funny stories and stories of people in life. Okay. Thank you so much to everyone. I want everybody to be blessed and safe and smooth. Thank you, everyone. God bless. Thank you, everybody on Facebook.